So we are going to talk about the complementarity of AI and the European health data space today. And let's start first from the Artificial Intelligence Act, which is actually the first regulation on artificial intelligence on a global base, and this is why it got so much publicity about. So AI Act is about different rules for different risk levels. We're talking about obligations for providers and users depending on the level of risk from artificial intelligence. And we're going to point out basically two different risk levels. First, the unacceptable risk. For example, the AI systems considered to be a threat to people, which could be, for example, social scoring. And second, the high risk. That means that AI systems that negatively affect safety, and this is used in products under the new General Product Safety Regulation, which is really new, published in December 2014, actually took into effect. And second, AI systems that negatively affect fundamental rights. That means they perform a function listed in Annex 3, which is high risk, about high risk. For example, systems make or support decisions affecting the urgency, allocation, or emergency health resources. Or AI obligations will apply 12 months after the their entry into force from May 2025. That means that the provision of AI Acts as a whole will be in full enforcement at the end, basically more or less, of 2027. So what about European health data space? Well, European health data space is a health-specific ecosystem of rules, common standards, practices, infrastructures, and basically a governance framework for both primary and secondary use. Which aims at, first of all, empowering individuals through increased digital access and basically and control of their electronic health records. Ελληνικά, ο λεγόμενος ηλεκτρονικός φάκελος υγείας, η IFI. At a national or European level. Second, fostering a single market for electronic health record systems relevant to medical devices and high-risk AI systems. And third, providing a trustworthy and efficient setup for the use of this health data, but for research, innovation, policy making, and regulatory activities, meaning secondary data use. The provisions of the European health data space will basically be applicable at the end of 2027, let's be optimistic. That means more or less at the same time frame with the AI Act. So why these two regulations matter together? First of all, the AI Act ensures trustworthy and safe AI solutions. Second, sets rules on how artificial intelligence systems, especially the high-risk ones, must be developed, trained, and deployed. As for the European health data space, it ensures secure and lawful data availability. Second, facilitates and obtaining high-quality, large-scale electronic health data by cross-border. This is the, let's emphasize here on cross-border exchange of patient data for both primary and secondary use. So about the interplay. First, we have to talk about the data access for AI development. The European Health Data Space establishes rules for secondary use of health data, overseen by health data access bodies across, of course, Europe. And second, requires approved applicants to ensure strict privacy and security measures. As for AI Act, for high-risk artificial intelligence, providers must use relevant, representative, and bias-free datasets. So the health space facilitates secure, lawful acquisition of high-quality health data for training and validation. Now, as for high-risk healthcare AI, the AI Act talks about certain healthcare AI systems that are classified as high risk and basically foresee obligations which include risk management and data governance. As for the health data space, this regulation facilitates cross-border data sharing for healthcare research and innovation, and AI developers should comply with both health data space conditions and AI Act safety and transparency requirement. Now, as for governance and oversights, each member state should design and establish a health data access board, and a European health data space board is foreseen as well, which will coordinate national access boards. The AI Act creates a European Artificial Intelligence Board and mandates national AI supervisory authorities to monitor AI providers. So AI developers should take into account that there will be basically two levels of board for both AI Act and for health data health data space. So now, as for technical documentation and transparency, in terms of AI Act, high-risk AI providers must maintain detailed technical documentation, but the same basically applies for health data space as well, because applications to use health data must include information about intended purpose, data processing methods, and security measures. And finally, about the individual rights and data privacy, the health space reinforced patients' rights to access and control, allowing the reuse of their electronic health data, and sets conditions for privacy protection in line with, of course, GDPR. Whereas AI Act foresees transparency provisions and basically cares about how the data will be used. So if we would like to talk about the musts that should be adopted by healthcare shareholders, for example, first category, healthcare providers and researchers. That would include, for example, clinics, public hospitals, and researchers who will and must handle data under the rules set by European Health Data Space and should deploy AI solutions that meet AI obligations. Now, as for AI and medtech developers, who should streamline access to large data sets under health space and must ensure compliance with high-risk AI rules. And finally, member states and regulators need to set up immediately, I would say, and adopt agencies for both regulations and coordinate oversight to minimize conflicting requirements. But overall, as Alexandros mentioned, healthcare stakeholders. Are you compliant not only with AI Act and European Health Data Space, but with an array of legal provisions which include GDPR, the new NIS 2, which is actually is published as of December 2025, and especially basically foresees special provisions for healthcare providers. The GPSR, which is the new published, this is a new regulation about general product safety, which is also published in 2025. There is a provision there about the gateway safety and many other provisions for healthcare providers. Of course, the EU Product Liability Directive, published as of November 2024, a new proposal for the moment for an AI liability directive or maybe a regulation for software, and finally the MDR and IVDR. So you should be compliant, and what you should do is first adopt a holistic compliance strategy on every stage of your product's lifestyle. Second, you should get ready with a cross-functional collaboration with a specific legal team, technical team, clinical and business team. Third, you should adopt a continuous monitoring adaptation because you should be updated on every level of legislative changes. And finally, you should keep a comprehensive documentation because compliance is a must on every level of your business strategy in case of audits. And this being said, thank you.